Okay, all well, in the interest of time, let's go ahead and get started. Welcome, happy Friday. This is the third recording and training for the data reporting tool for Elevate Youth California. This one, we're focused on youth empowerment, leadership, and development. And the previous two recordings have been posted to the shscenter.org website. If you go to the Elevate Youth California tab, you'll see the previous two recordings. Just a reminder, we're using the chat feature for Q&A, so feel free to use that if anything comes up throughout the training. So as you know, it's a fairly consistent agenda. Just a reminder of the evaluation, what we're all hoping to learn from the evaluation process, to review in detail the tab of youth empowerment, leadership, and development, and then to answer any questions. So we'll go ahead and get started. Just a reminder, the evaluation is really to understand program impact, to understand the diversity from a racial, ethnic, and cultural perspective of the youth engaged, and then the kind of progress and on the policy systems and environmental change you all have embedded within your scopes of work. So kind of a three-pronged approach to our learning, and we've been working with the Department of Healthcare Services on the development of this data reporting tool, and have really appreciated the questions that have been sent over through the chat in the two previous trainings. Again, want to make sure that this is relevant, it's clear, so feel free to continue to ask questions so that, you know, if you have that question, likely others do too. All right, let me move us into to share the reporting tool, and everybody should have that. So here we are. This is the tab that we'll be covering today. So this is the youth empowerment, leadership, and development. And again, as we've done in the past, we'll just go line by line, talk through the various elements that are requested. And just a reminder that these, the first deliverable is due, and the reporting schedule is on the background and definitions tab, but the first deliverable is due July 31st to the center. Okay, the first section of this reporting tool tab is specific to the prevention program activities for this reporting period. So this is where you'll list the date, the location of prevention program activities carried out during this reporting period, and indicate how many participants there were in each activity. So this is requesting the date of those events, the county in which they took place, the specific zip code, and then, for example, there's some additional clarifying information, write RC if the activity was carried out through remote contact, and then the total number of participants. And you know, recognizing the remote contact may be related to COVID-19 and the various ways that you are engaging young people using technology, and those aspects that obviously have had to modify some of the youth engagement over the last few months. The next section, did staff that are directly serving youth receive training prior to facilitating peer-led and leadership development activities? So here are some examples, and we know, you know, anytime there's a list, we recognize it's not going to be comprehensive. It won't be including all areas of content, but it could be a starting point, and these are just some examples. So here you can list some of those trainings here. The first one, staff received training by funded organizations using an evidence-based curriculum, and having read your scopes of work and the narratives accompanying your applications, we know there are a number of professional development opportunities that you have lined up for both your staff and for other partners who are engaged in the work. So this will be your opportunity to report on that, especially focused specifically on those that are working directly with young people. The next category here is staff received training from an external partner contracted through the funded project. The next, staff had previous experience implementing funded programs similar to Elevate Youth California. And then a section where you'll be able to identify others, other kinds of training, and the staff who are working directly with young people. So would ask that you complete the left side, both in line 11, 12, 13, and if you need to add your own, which is completely okay, line 14 is there as well. If training occurred, so I'm moving now to line 16, if training occurred this quarter, please list what training programs, curriculums, or resources were used. A couple of aspects here. This will help us aggregate the kinds of professional development and training that's taking place across the 26 projects, and then just help us understand what kinds of themes that we're seeing in terms of professional development and training, which would inform how we move forward. So this is our plan here. Or I should say, this is our way of learning what your professional development training is taking place at, within your project. Here you can list of trainings, and really more focused on the titles and the potential learning objectives of those trainings. So please list, and you have plenty of space to go into detail there. So you're moving on to the next section. How many adult allies and/or peer mentors supported this project during this reporting period by working directly with mentees? So, one of the aspects of this, of Elevate Youth California, in addition to the youth activism, you had an opportunity to include either peer mentoring or peer-to-peer support, and then also mentoring. And some projects chose to do all three strategies to achieve their objectives. And so this is one area that for those that have adult allies or the peer-to-peer support, this is where you will be able to identify the number of mentors involved during the reporting period. And just, remember, it is for the reporting period. The next section, as was required in all of the projects, there had to be at least an annual listening session with young people, and this is where you will have an opportunity to list that. So please, it should be as a drop down. And then in the very next section, and we'd received this question previously, so if yes, please provide highlights of the youth listening session. So both from a numbers perspective, we want to know the number of youth in attendance, and highlights. So that could be the themes that you heard from the listening session. It could be some expression of the diversity of the young people who attended. Was there a focus on a specific youth population? That could be system impacted, could be justice involved, could be specific to a racial, ethnic, or cultural group, similar to the previous demographics tab. So, please describe and in this highlight section, a bit of detail related to your youth listening session. Some groups, some partners wrote more than one listening session in your scope of work. So, and that's okay, but this, when it takes place during the associated reporting period, please respond regardless, but if it's yes, then provide those details in this section here. I did see a question come in. Does Sierra Health Foundation plan to make any training available? So the answer is yes. At this point, there's a couple of paths we're taking. One, related to COVID-19, and I mentioned this, I believe, on the first call, we do plan to roll out a survey within the coming weeks to determine some of the project specific and then then themes across the entire 26 partner cohort around the kind of training and technical assistance needs that are required during this time of shelter in place and physical distancing. So these are the, I guess, first phase, and that that really won't have any ramifications until later in the summer. But the survey should be rolled out later within the month. The second area related to training and technical assistance is we did ask specifically in the application what kind of technical assistance needs do projects anticipate requiring during the project time period. And so we have some themes related to data collection, building organizational and community capacity for policy and systems change. So there are a number of themes that we heard from you all, and there will be a kind of a second phase of technical assistance and training. What I would say though is many of the in your applications, you wrote either potential contractual partnerships or relationships with training organizations, and that's great, and would encourage you to continue as that was part of your plan. Continue down that path. I would say it will be informed. Ours will be informed by yours, especially those questions that were part of the application process. So kind of a two-phase technical assistance and training plan for this group. Okay, so I mean that really covers this tab. I know we were just trying to make these brief theme trainings for the reporting tool. So that is really the spirit of this each of these calls. But I do want to pause if you have other questions or we need to clarify something related to the youth empowerment tab. Feel free to ask. Use the chat feature. We're happy to spend the time if necessary. This was a little more brief than some of the others, but that's okay. Let's spend the time if we need it. Any other questions related to the youth empowerment tab? Is everything clear? Does it make sense? I know we had some really good feedback on the last call, which I've shared with our partners at the Department of Healthcare Services. Any other like reactions, or does it seem pretty straightforward? I'll take silence as it's pretty straightforward. Okay, there's one response. No, okay, good question. Are we limited to reporting 3 prevention activities per quarter? No. I mean, you're allowed to add to the lines if necessary. I would say though that in one of the previous tabs, we did ask what were some of the top 3 activities, and would encourage you to make to have it sort of be consistent. But there may be other activities not related to those top 3. And this is your opportunity to speak to those activities, especially when it comes to youth engagement and youth leadership development. So yeah, feel free to expand, give us and the Department of Healthcare Services a comprehensive view of those activities. So this is your opportunity to do so. And I just want to underscore the DHCS has really worked hard to make this as simplified. We didn't collectively we didn't want to have a huge burden on our partners, wanting to really prioritize the work. But this is a way for us to understand sort of the community level impact, the individual level impact, and as I said, related to the policy and systems change process. Any other questions or clarifying comments? Okay, well, I'm not seeing any, and I'm not going to force you to stay on the line if it's been if we've been covered already. So, just as a reminder, the previous two recordings are posted to the SHF Center .org or website specific to Elevate Youth California. Oh, here is one more question. Oh, a couple questions just came in. So, first one, can you give us an example of what would be considered as other leadership development activities? And let's see here. I guess what I'm struggling a bit with is the term the other. So can you give us an example of what would be considered as other leadership development activities? So, I mean, defining leadership development activities could be working directly with young people on their process. Some of the applicants listed a more participatory process related to training and supporting young people in developing policy recommendations for their communities related to youth substance use. And so that kind of training, support, working directly with youth, helping support adult mentors, working directly with young people. We saw some proposals where young people are equipped to work directly with their, their peers, those that are also young people. So that kind of those kind of activities, the actual support that's happening, likely modified right now because of the requirements related to the stay-at-home orders. But those are some of the activities that we would expect to see. The preparation of those mentors and the young people who are supporting their peers would also be captured in the training section. So if you have done some sort of maybe, I'm just, gonna make something up here at this point. If you've trained your mentors in trauma-informed practices in working with young people, then I would list that in the section. And especially if it's an evidence-based curriculum, that would be something that you'd want to highlight within that section. If you've already done some training for the mentors who are working on this project now, I would still list that because there's a section specifically in that area for training and professional development. So I hope that's helpful, especially when it comes to working with directly with the youth that were written in. Then I would make sure that those activities are listed. Let's see. Here's a question. Would it be possible for the various partners to share the trainings that they use? And here's what I would say is as we get the responses to the deliverables, then we can collect the specific things that are going on across the projects and then start sharing some of those. We're also planning to do right now there was a scheduled in-person training. Obviously, we're going to have to modify that in the fall of this year. And so that would be another area where we could help identify some of the trainings that are taking place across the various programs. Let's see here. Let's see. Oh, okay. We do a lot of one-on-one coaching for prevention program activities, and this list could get very lengthy if listed one by one. So yeah, could you list them by bulk per county? Yes, I think the answer is yes. You could aggregate that. So for example, if you were in Sacramento County and you said, even though the sessions are happening one-on-one, you could aggregate those and say, say 10 one-on-one coaching sessions, number of participants 10. So that would be, one example. So those kinds of things, I think you would really want to. I agree. The list could get quite lengthy, but where you can aggregate it, I would say that makes total sense. Okay. Any other Any other questions? Not trying to rush, but I also you know, would love to give you back time. But if you do have some additional questions, feel free to use the chat feature. Okay, well, I'm not seeing any, but if you do, if coming off of the call, if you know, all of a sudden something comes to mind, would encourage you to reach out, give me a call. This is my direct line, or shoot me an email. I'll try to be as responsive as possible, and then happy to follow up after the call. So with that, I will just say thank you for everybody's time. Have a wonderful weekend. Back to self-care. I hope you know, there's been just a tremendous amount of stress, anxiety, and I just know that it's all affecting your young people, your staff, all that you serve and all that you do across the state. Just express appreciation. Please do take care of yourself, and appreciate you know, the time that we spent today. We will have 2 additional sessions next week, and so we're happy to finalize the trainings, and then we'll expect the deliverables at the end of July. So please do take care of yourself, and look forward to seeing you here next week for our next training. All right, thank you all. Take care. Bye-bye.